Welcome to One Training, where we provide health and fitness content to help you achieve your goals. Choose the fitness course professional athletes trust. Click the link in the comments to learn more.
Hi everyone, this is Chris from One Training. In today's video, we're going to look at a little case study for a gentleman named John. We're going to discuss his risk factors and how they'll impact his participation or change his exercise program. Okay, so to kind of set the scene, understanding and addressing risk factors is crucial, not just for John but for any client. Okay, because we want to make sure that first and foremost their safety is taken care of, and also that we can optimize his fitness journey or help him achieve his goals. Okay, so today we're looking at John's pre-screening tool, and we're going to just go through the risk factors that come up and how we can consider these when designing his exercise program. Okay, so firstly, John's been diagnosed with COPD, or a chronic respiratory disease often associated with smoking. Okay, so it's a byproduct of smoking, if you will. Okay, so this can cause shortness of breath, reduced lung function, and also a reduction in his tolerance to exercise. Okay, so if we account for these first two straight off the bat, obviously when he is exercising, these two are going to limit his ability to go for longer periods of time or at higher intensities. Okay, so we need to tailor John's program to accommodate for this and make sure that he can exercise safely, and then we're not, exacerbating his breathing difficulties. So his second risk factor is his chronic asthma. Okay, so this causes inflammation in the airways, the windpipe, if you will, or the bronchioles that lead into the lungs. Okay, so this can mean that he's, if he's breathing, he's often somewhat wheezy. He might have a very constant cough, or even just difficulty breathing full stop. Okay, so to prevent asthma attacks during exercise, which is our main concern, okay, we've got to be really, really cautious and make sure that we do a proper warm up. We progress the intensity of the session gradually, or even the sessions, if you will, okay, and monitor his breathing throughout the workout. So if he does start to show some of the symptoms like wheezing, coughing, difficulty breathing, obviously we have to intervene and stop. The third risk factor, so John has type 2 diabetes, and this, in a really simple way, affects his body's ability to regulate blood sugar. Okay, so it affects his energy levels to an extent. So exercise can have a positive impact on how we manage it, how his blood sugars level out. Okay, but we've got to be really, really careful about what his sugar levels are like before, during, and after exercise. Okay, because if there's any rapid change or too rapid, or he's too low before he begins, okay, obviously he could be go into some sort of episode, if you will. So we've got to regularly monitor his the intensity of his workouts in accordance with how he's feeling that day. Okay, so if he shows up and says his blood sugar's a bit up and down, okay, obviously we don't want to really push him in that session, and just make sure that we can always have, often diabetics will have sort of jelly beans or their medication nearby, just in case they do start to feel a bit odd, a bit funny. Okay, it's all about looking after John and making sure he stays safe. Lastly, so John has a family history of heart disease. Okay, and on the screening tool, he's noted that his father had a heart attack when he was younger than 55. Okay, so that attributes a risk factor on the screening tool. So this means that he's far more likely to have cardiovascular issues, again, because of it being a genetic predisposition, okay, or a hereditary condition. Okay, so this just means that we're going to do everything we can to look at and take care of John's cardiovascular health, and consider exercises, or choose exercises and a program that are going to improve his heart health and make sure he stays safe. Okay, so looking at his heart rate, his blood pressure, potentially before and after workouts if needed, and also making sure that we choose a safe intensity is key in order to not exacerbate this condition. Okay. So if we take these 4 risk factors into account, we can create a personalized program that's going to address his respiratory health and conditions, so COPD. We're going to take care of his asthma and try to manage that, control his blood sugars and diabetes by doing certain things with his program. And also, as we mentioned with his family history, being mindful of his cardiovascular considerations, okay? So this means that we can take care and keep an eye on all these things while also considering what he wants to do, what his needs are and what his exercise goals are. Okay, so on top of that, obviously referring to a professional who can give us some guidance or even give us some advice on the program we've written for him is crucial. Okay, because these individuals have a far greater understanding than we do. Okay, so our realm of expertise is exercise programs. So if we can create the safest possible program, then obviously we can help the individual, but for the condition themselves, again, it's out of our scope of practice. So by considering these things and tailoring his exercise program where we need to, we can create the safest and most effective program for John's overall well-being. Okay, well, that's it for today. Hope you found that helpful.